नमस्कार, मैं डॉक्टर शालिनी उपाध्याय, डिपार्टमेंट ऑफ माइक्रोबायोलॉजी SGTU से। मैं आपको आज एक छोटे से वीडियो से ये बताना चाहती हूँ कि हम कोविड-19 जो कि SARS-CoV-2 वायरस से होता है उसका सैंपल कैसे लें और टेस्टिंग कैसे करते हैं, और जो उससे रिलेटेड क्वेश्चंस हैं उसको भी आंसर करने की कोशिश करूँगी। तो सबसे पहले हमें ये जानना चाहिए कि हम किन पेशेंट्स को टेस्ट करेंगे। जो इंडियन काउंसिल ऑफ मेडिकल रिसर्च है, they have given a strategy for testing of COVID-19. The strategies include 6 categories. The first category is all the symptomatic patients who have underwent a international travel in the last 14 days. The second category includes all the symptomatic patients who are contact of lab confirmed cases. Third is all the symptomatic healthcare workers. And fourth is all the cases of severe acute respiratory infection that includes fever, cough and shortness of breath. The fifth category is asymptomatic direct and high risk contacts of all the lab confirmed cases should be tested between day 5 and day 14 after the contact. And the last group, that is 6th group, is for the hotspot clusters, large migration groups and evacuee camps. That category includes all the symptomatic influenza-like illnesses. For collection of sample for testing of COVID-19, so I'm going to enumerate what are the requirements. First is we need a viral transport media which has antibacterial agent, that is gentamicin, and antifungal agent which is amphotericin B to inhibit the growth of any contaminants and allow the growth of only viruses. The second thing is the swab, that is flocked swab, which we use to take the nasopharyngeal, nasal or throat swab. The third thing is primary receptacle in which we are going to store the VTM with the sample. Then after the primary receptacle is ready, we are going to seal it with either tissue or absorbent material like cotton. Then we are going to pack it into a secondary receptacle, which is either a plastic Ziploc bag or a container which is leak proof. Then when it is packed, we are going to transfer it into a third, that is tertiary receptacle, which is provided with gel packs which will maintain the temperature of the sample between 2 to 8 degrees Celsius. If we need to store the sample for more than 5 days, then we have to freeze the sample at -72 degrees Celsius. So we have to transport it in dry ice packs. When the sample is finally packed in the final receptacle, it is properly sealed and a requisition form properly filled with patient information and information regarding the person who is sending the sample should accompany the sample, and it is sent to the microbiology lab for further testing. For collection of sample for testing of SARS-CoV-2 or disease COVID-19, we take nasal swab, nasopharyngeal or throat swab. For collection of the sample, first we have to perform the hand hygiene and don proper PPE. We have to inform the patient about the process of sample collection and tell them if they feel like sneezing or coughing, they should use either tissue or bent elbow. For collection of the nasal swab, the swab is inserted around 2 to 2.5 centimeter into first nares and rotated against the interior nasal mucosa for 3 seconds. Then the swab is withdrawn and again the process repeated for the second nares. For collection of nasopharyngeal swab, the swab is entered along the floor of the nose until posterior nasopharynx is reached and rotated for a few seconds and withdrawn. For collection of throat swab, swab is entered into the mouth. Tonsillar arches are swabbed at the posterior pharyngeal wall. The swab is removed from the mouth and it is entered into the viral transport media and broken at appropriate height and sealed.
So the sample has reached Department of Microbiology. In the laboratory, the sample is transferred to sample processing room. There the technician takes all the precautions as per biosafety level 2 and starts processing the sample, that is extraction of viral RNA. After extraction of the RNA, the specimen is rendered non-infectious. Now it is transferred to master mix room. After the master mix room processing, the final step is done in the real-time PCR room. There, the sample is processed by the real-time PCR machine. The whole process takes about 8 hours and the report is generated. Once the report is generated, it is evaluated and given to the patient the same day. For screening test, we detect E gene by real-time PCR, and for confirmatory test, we detect RDRP, E or N genes. Recently, Government of India has also recommended use of rapid antibody-based test for detection of SARS-CoV-2 as a point of care test. Thank you.